how can we maintain a healthy gut? What exactly makes a gut unhealthy in the first place? Are you interested in the role that the microbiome has to play in our immune system? Do probiotic supplements and probiotic foods improve gut health? Join us for expert insights and live Q&A sessions on gut health and discover evidence-based insights to a thriving microbiome. Hello and welcome everyone to session 2 of the Friendly Pharmacy 5 book club. We are featuring the book Gut Logic by Graham Mackenzie. Thank you so much for joining us. If you were with us last session or if you're just joining us today, thank you so much for being here. Let us know in the comments who you are, where you're from, and what you're looking forward to learning in these evidence-based sessions on gut health. Before we start out, I wanted to share a few insights with you about gut health. So, did you know that the number of genes in all the microbes in one person's microbiome is 200 times the number of genes in the human genome? Also, the microbiome likely weighs as much as 5 pounds in a healthy adult. The bacteria that are most numerous members of the human bacteria are the most numerous members of the human microbiome because we also have fungi and protozoa, and we're going to talk about that in a few minutes. But the bacterial population alone is estimated at between 75 trillion and 200 trillion individual organisms in the human body. And the entire human body consists of about 50 to 100 trillion somatic body cells. Did you know that approximately 90% of the body's serotonin is produced in the gut, where it is known to influence immunity? And we are really just learning. I know that we are really just scratching the surface of the whole topic and the science of gut health. And so today we have Graham Mackenzie with us. He is the author of the book Gut Logic. And Graham, thank you so much for being with us today and joining us on the show.
Thanks. Good to be here again, Lindsay.
Yeah, it's definitely great to have you. And today we're going to focus, Graham is going to be speaking on gut health and cholesterol as well as weight loss and what the evidence is for that and what evidence we still might be waiting on for that. Right, Graham?
Yeah, so those two topics are always a couple of topics that you might lose people that are, I suppose, in the medical field, but we're being as truthful as we can on the evidence for this.
Absolutely. And so, again, if you're just joining us, let us know where you're from. Graham has also been so generous to offer one book to one of our lucky audience members today. So if you do make a comment, you will be put into our draw for one Gut Logic book, and we will send that out to you. Last year, we had someone from North Vancouver, Canada, who won, or last week, sorry. And this week, who knows? Because we had people joining us from all over the world. We had people from the UK and from China and from the US and Canada. So make a comment there, maybe ask a question or let us know where you're from. And you will be entered into that draw to win one of the Gut Logic books. Just a couple housekeeping items before we get into the sessions. If you would like the transcripts from the Q&As, so we are going to do a couple of presentations today on gut health, but afterwards there will be a Q&A. And if you would like a transcript of the Q&A, you can go to the friendlypharmacy5.com website and just register for our newsletter, and you will be getting those Q&As for all of the sessions. So again, that's www.friendlypharmacy5.com. It's up there on the screen for the Q&A transcripts. Also, all of these sessions will be live and they will be up for a limited time only. So they're free and we're not selling you anything on these sessions, but they are up for a limited time only. So just as long as you're aware of that. Yeah. And then also, I wanted to put a word out to our sponsors. So our sponsor for today is the Friendly Pharmacy 5 podcast. Did you know that we, in addition to having a YouTube channel, we do have a audio podcast. And so you can listen to our interviews with our experts on Spotify and Apple Podcasts. So that's the end of my little spiel today. Thank you so much again for joining us. And I think we'll get right into the discussion. So today I'm going to be presenting on the topic of how to feed your gut microbiome. So let's just get into that right now. So I've titled this Eat or Be Eaten, Feeding Your Gut Microbes for Optimal Health. And you'll understand why I've said that in a moment. So learning objectives today, I would like you, hopefully by the end of this, to understand the difference between probiotic, prebiotic, and postbiotic. Also, hopefully you will understand the role of soluble versus insoluble fiber. You'll understand the implications of a low fiber diet versus a high fiber diet. You'll know the various sources of what are called microbiota accessible carbohydrates, or MACs. You'll also understand the role of short chain fatty acids in gut metabolism. And we're going to explain the potential benefits and sources of fermented foods at the end, as well as some of their benefits. So hang in there. It's going to be a bit of a fire hose, but I'll do my best to make it clear and easy to understand. Before we get into the slides, just know that this presentation is for educational purposes only. It is not health advice. Even dietary changes can really have an impact on not only your health, but also medications and different supplements. So speak with your healthcare provider or your pharmacist before you make any drastic changes to your diet, medication, supplements, or otherwise. So what is the human microbiome? We spoke a little bit about this in our last session, but just to recap, the human microbiome really encompasses the entire body. It's not just the gut. We are complete with bacteria on our skin, in our mouth, in our respiratory system. Even in utero, it was thought that used to be a sterile place where the baby is growing inside the mother's womb. However, we know now that the amniotic fluid is actually replete with bacteria that the fetus is able to ingest, and so that's something new that we've learned. But when we speak of the human microbiome, we're not only speaking of bacteria, we're also speaking of fungi, viruses, and protozoa. So we really have this whole ecosystem that we're all walking around with on a day-to-day basis, and that we carry with us. And what is the role that the human microbiota plays in the human body? Well, they do help us. They help to digest our food. They have a role in regulating our immune system, and they protect us against pathogenic bacteria, or bacteria that can cause harm or cause disease. They also help us to produce certain vitamins like vitamin B12, thiamine, riboflavin, and even vitamin K. But what about pathogenic bacteria? So when we hear about the microbiome, it's always seems to be a very positive conversation, but we cannot forget that bacteria can be pathogenic. They can cause disease, and they can be very detrimental to us. And so a lot of us, we actually have a lot of these bacteria that can potentially be pathogenic in our bodies. And what differs is really the quantity of these and the opportunity for these bacteria to cause infection. The one that comes to mind would be C. diff, which is a bacteria that I believe over 90% of people do have in their gut, but it doesn't cause infection unless there's an opportunity. And that opportunity is usually when the person is on antibiotics. So when we speak of probiotics, prebiotics, when we speak of bacteria in the microbiome, I think it's just important to remember that not all bacteria are good bacteria, right? And so there's a few caveats that go along with that. The gut microbiome also changes constantly. It changes in diversity, composition, quantity, and function. And it changes as we age. As we age, our microbiome tends to lose diversity, lose function, even sometimes lose quantity. Antibiotics and other medications, which Graham is going to speak about later, can also affect our microbiome. Menopause and the changes that occur with menopause, there have been observed changes in the microbiome. Also, intense stress has been observed to change the microbiome. Circadian rhythm disruptions, such as when someone travels and they're traveling to to or from a different time zone, the microbiome changes. And so this is a very dynamic environment that we're talking about here. Also, lifestyle changes. So it used to be that before we were part of an industrialized society, people were living in more rural areas, they were working on farms and that kind of thing. And the move to a more industrialized society where we live in more urban areas and big cities has not had a good effect on our microbiome. And this is fairly well established at this point. The caveat here before I go any further is that this is all new science, and anyone that purports to be an expert in this area is someone that is constantly learning. And so it could be that, a year from now or 5 years from now, a lot of this information may have changed. And so what we're doing today is we are trying to share the best evidence with you without getting into the weeds too much and without giving you necessarily any band-aid approaches or sell you anything like that, because this is new science and it's fraught even with controversy in some areas over definitions and again, it's changing. So please know that we're trying to give you the best evidence, but it's new science and it is subject to change. So going back to our slides here, just one moment. All right, so a question that came up last week was, what is the difference between prebiotics and probiotics? And I hope that person is here today because we're going to answer that question and try to clarify that for you today, because there's some terminology that we need to understand. And it starts with that, the difference between prebiotics, probiotics, and even postbiotics. And there's one more term that I'm going to introduce to you in a moment as well that you'll be able to understand. So prebiotics, these are the actual definitions, okay? So prebiotics are known to be a substrate that is selectively utilized by host microorganisms, conferring a health benefit. And this conferring a health benefit is very key in this definition. An example would be some types of fiber. So we are going to go deep into fiber in a few minutes. But that would be the definition of a prebiotic. Prebiotics, you could also think of them as something that feeds the microorganism, right? Probiotics are the live microorganism that, when administered in adequate amounts, confer a health benefit. You see that conferring a health benefit included in the definition again. So an example of that would be Saccharomyces boulardii for the prevention of traveler's diarrhea. And so there is some evidence that I've actually shared in a recent video on travel health that's showing that Saccharomyces boulardii, when consumed in the right amount for the right period of time, may help with the prevention of traveler's diarrhea. And so in that case, it would be part of the definition or be under the definition of a probiotic. Postbiotics are the definition of these is a little bit disputed. However, the best definition that I could find that was from the International Scientific Society on probiotics was the preparation of inanimate microorganisms and or their components that confer a health benefit to the host. So you can see with all of these pre, pro, and postbiotics, these are always conferring a health benefit to the host. And so there's a lot of products out there that are just say they have probiotics in them or they say they have prebiotics, but we don't necessarily have evidence that they confer a health benefit. And so that's going to be something that we focus on in these sessions. So I hope that's clear. Now, if we go a little bit further, there's also a new term called synbiotics. And synbiotics can be understood as a combination of two or more of these products. So they can be defined as a mixture of live microorganisms and substrates selectively utilized by host microorganisms that confer a health benefit to the host. So an easy example of this would be if you have a capsule that's containing lactobacillus and you have its preferred food in there, such as lactose. And there seems to be some theories that if you give the bacteria its food in the capsule, then when it dissolves, it maybe has a longer chance or a better chance of surviving inside the host. So synbiotics is a pretty new term, but I wanted to mention it just because it's something that may come up and is probably more likely to come up more and more over time. All right. Dysbiosis is another term that I'd like you to be familiar with, and I'm sure our speaker next week is going to use this term as well. So dysbiosis is when we have an imbalance of gut bacteria, and that's where we can get infections and different symptoms, gastrointestinal symptoms. So this refers to an imbalance between the types of organism present in a person's natural microflora, especially that of the gut. And this is thought to contribute to a range of conditions of ill health, and it can occur in almost any part of the gastrointestinal system, the stomach, the small or the large intestine. And so we have all of these bacteria, protozoa, fungi, and this whole ecosystem with us. But where are these bacteria? Where do they live, and where are they most abundant? Because it's important that we discuss that, because, yeah, that will just become important as we go on here. So the majority of the bacteria that make up our gut microbiome, which are mostly anaerobes, meaning that they do not use oxygen or need oxygen to survive, they live in the large intestine, more specifically in the colon. And if you want to get even more specific, we're usually referring to the distal colon. So if you look at this photo, we're talking about this white part of the photo, right? So this is the colon. So this is where the majority of these bacteria live and thrive. So back to the title of this presentation, Eat or Be Eaten, we're going to get into the topic of probiotics. Prebiotics, the selective food for gut bacteria. So if you don't feed your microbiome, it can have wide-ranging implications, and we're going to go into that here. But what are prebiotics? How can we feed our microbiome and keep them happy? So prebiotics are, as I said earlier, a substrate that is selectively utilized by host microorganisms, conferring a health benefit. And the health benefits of prebiotics are agreed upon to be due to their fermentability by gut microbiota. So essentially, the gut microbiota are able to ferment these foods and use them essentially as fuel. And then the gut microbiota are able to produce different substances that are beneficial both to the colon itself or the gastrointestinal system, but also to different parts of the body, which we will get into. So you can see that we've gone over prebiotics, probiotics, and postbiotics, but prebiotics do influence probiotics, and they can influence, consequently, probiotics, right? So I just wanted to make that link there. So when we speak of prebiotics, we're primarily speaking of fiber. Now, there are some non-fiber prebiotics that are still being studied, and those refer to lactulose, polyphenols, and polyunsaturated fatty acids, which we're not really going to get into for the purposes of this presentation. But when we talk about fiber, we're essentially talking about what we know as non-digestible carbohydrates. So these are carbohydrates that our body cannot really digest ourselves, but the bacteria in our gut can use these and can ferment these for their own purposes. And again, these are often talked about as microbiota accessible carbohydrates, specifically soluble fibers. Okay, so these are carbohydrates that can be metabolically used by our gut microbes. Now, it's important to mention that it's not just soluble fiber that is important, because insoluble fiber is also important and it has a different purpose. So an example of this would be cellulose. So cellulose is not a prebiotic because it is not used by our gut microbiome to produce anything specific, but it is used by the intestines as a bulking agent, as an agent that can help to maintain the consistency of our stool and encourage frequent bowel movements and that kind of thing. So both types of fiber still have their importance. And the other thing about this insoluble fiber is that it can also blunt the blood glucose response and reduce the absorption of glucose. And Graham might go into that, I think, in a few minutes here. Yeah, I just want to touch on that. So when we have fiber, again, we have the soluble and insoluble fibers. Soluble fibers are otherwise known as these MACs that I've mentioned. But it's important to mention that a lot of these foods have both soluble and insoluble fibers. So the food itself does not grow in a specific way in that it's soluble or insoluble. A lot of food has both, right? But here's some examples of soluble fibers and some examples of insoluble fibers there for you. Some people may be familiar with the brand Metamucil, which is commonly used here in Canada. The main ingredient of that is psyllium husk, and that contains both soluble and insoluble fibers, as an example. So our gut bacteria are able to feed on these prebiotics and ferment them. And the fermentation process gives rise to a variety of molecules that are used both locally in the gut and in other parts of the body. So essentially, we have these microbiota accessible carbohydrates. These are resistant to digestion. And then what happens is once the food gets into the colon, these bacteria are able to ferment them. And one of the very important things that these bacteria produce, when in the presence of these prebiotics, are short chain fatty acids. And the main ones, I believe over 90% of the short chain fatty acids that are produced are butyrate, propionate, and acetate. So what role do these play in the body? Well, when the body is able to produce these short chain fatty acids, these short chain fatty acids are absorbed and metabolized by the colonocytes. Now, the colonocytes are the cells that line the inner lining of the large intestine. And they're actually used, I believe one of them, I think it's butyrate, is Graham, you can correct me here if you want. But I think it's butyrate that's used as the primary energy source for the colonocytes. These short chain fatty acids are also metabolized by the liver. And that's important because that indicates that just the short chain fatty acids work not only locally, but they can also move about the body, right? And they can be transported to different parts of the body because we know that they are metabolized and used by the liver. So going back to our presentation here, some of the benefits of prebiotics and the short chain fatty acids that are produced, there's so many here and I cannot go over all of the benefits, but we have learned that these short chain fatty acids have protective effects against colon cancer. They reduce the prevalence and duration of antibiotic-associated diarrhea. They decrease the pH in the colon, which helps to increase the absorption of minerals like calcium and magnesium while reducing the presence of toxic bacterial metabolites. They have a beneficial effect on bifidobacteria and lactobacilli. A recent study also found that enhancing the supply of propionate may alleviate mitochondrial dysfunction, oxidative stress, and apoptosis induced by free fatty acids. You can see that the benefits of short chain fatty acids are immense. I'm not going to go into this here. If you want to keep this, maybe do a screenshot or something or come back to this. But really, there's so many benefits that we're learning of and that we probably will learn more about in the future here. So what happens if we do not feed our gut microbiome with things like prebiotics? What happens is these bacteria are not going to go hungry and it's at your own expense. And so sadly, what often gets lost in the deluge of marketing and all the hype about the microbiome is that a diet high in these non-digestible carbohydrates like dietary fiber provides the fuel that is essential for these microbes to thrive. And in doing this, we can avoid problems like dysbiosis. And we know that a diet that is composed of a very low fiber intake is at a higher risk of dysbiosis. So dysbiosis is a breeding ground for inflammation, and it has been associated with numerous diseases such as IBS, obesity, type 1 and type 2 diabetes, autism, and certain gastrointestinal cancers. Studies have also shown that a diet low in probiotics can lead to an increase in what we know as mucin-consuming bacteria. So mucin is a carbohydrate layer that lines the intestines, and it helps to protect the integrity of the walls of the intestines. And so if you see this graphic here from AE ProBio, this green lining here is the mucin lining in the lumen of the intestines. And if you're not feeding your good bacteria in your gut, they're going to start eating away at this lining. Now, this specific infographic, I should say, is referring to COVID-19 infection. But what I really want you to see here is the mucin lining that can be degraded even by the proper your own bacteria eating away at this lining, for instance. And then when that happens, the tight junctions that we know are in between these cells can be compromised. And so there's theories that that is how certain pathogenic bacteria and different inflammatory markers can enter the body and start to cause a real disruption there. So I hope that gives you a good idea of what can happen here with that mucin, which is that protective mucosal layer in our gut. So essentially, this is why I've titled this "Eat or Be Eaten," because when you have this kind of situation and when you have the mucin that's being degraded, you are at higher risk of inflammation, and that often presents itself in many different ways. Some of which is like gastrointestinal upset, but there can also be immunological, immune, and even neoplastic issues with that, which we won't go deep into here. However, there is good news. Dr. Justin Sonnenberg from University of Stanford has said that diet is the major tool that we have for manipulating our gut microbiomes in terms of both composition and function. And then there's really a lot that we can do here in terms of diet. So it used to be that hunter-gatherers consumed about 100 grams of fiber a day. And now in our modern and industrialized society, the average American adult only eats about 10 to 15 grams of total fiber per day. So that's a drastic reduction in the amount of fiber that we're getting, largely due to just our change in lifestyle, change in diet, more processed foods, right? So the current recommended intake of dietary fiber from Health Canada is about 25 grams per day for women and 38 grams of fiber per day for men. And again, the actual intake is about 14 grams. For the average American, it's about 10 to 15 grams. I've heard as low as 2 grams a day. There was a study that reviewed 25 previous findings, and it was showing that, for every 10 grams of fiber in your diet, your risk of colon cancer decreases by about 10%. And so it's quite important, and the benefits are wide-ranging if you are able to increase your dietary fiber and prioritize fiber in your diet. So what are these microbiota accessible carbohydrates? Again, these are those carbohydrates or fibers that are resistant to digestion in the upper gastrointestinal tract, but can be used by the bacteria in your lower intestinal tract or in the colon specifically. So an example of MACs would be inulin, fructooligosaccharides, and resistant starch, okay? And these are usually found in fruits, vegetables, whole grains, nuts, seeds, and legumes. And specifically, if you want to go even deeper, there's a few examples there of foods that you could add to your diet that contain these microbiota accessible carbohydrates, and then allow your bacteria to produce those important short chain fatty acids that we discussed earlier. I hope this is all making sense. Let me know in the comments if you're able to follow. Also, butyrate is one of the really important short chain fatty acids. And like I said earlier, it's the main energy source for colonocytes. So there are full fat dairy products that do contain butyrate that you can eat. However, these are high in saturated fat and cholesterol. And Graham mentions this in the book. A lot of this is straight from the Gut Logic book. So if you want a good reference for all of this, that the book would be the place to find it. So butter, ghee, cheese, and milk are also good sources of butyrate. And then how do you find these prebiotics in prepared foods? Because they don't usually say on the ingredient package prebiotics. You're not going to find that word anywhere. The recommended dietary intake is 3 to 5 grams per day from the International Scientific Association on Probiotics and Prebiotics. So how do you find these when you're looking at different ingredients of foods that you might be buying? So look for these ingredients that I've listed here, and I'm not going to try to pronounce all of them. But if you look for these, you can be assured that you are getting prebiotics in your food preparations. Quickly, fermented foods here. So the definition of fermented foods, because I know there's a lot of interest in fermented foods, they're preparations made through desired microbial growth and enzymatic conversions of food components. So essentially, these are foods that have been changed by some kind of enzymatic process or cooking process, and their properties change. It's important to know that fermented foods are not probiotics. So, fermented foods can contain probiotics, and often fermented foods have probiotics added to them. And you know that by looking on the label again. And usually, the industry will write contains live cultures if they've added probiotics to it. Some of them do contain microorganisms and bacteria, but we don't know if these confer necessarily a health benefit in each case, right? So that's something to watch for. So for foods that contain some live microbes, usually, although if you were in our last session, you heard Dragana mention that not all yogurt contains live microbes because of the heating process involved. But yogurt usually does have some microbes in it as well. We have kefir, we have kombucha, kimchi, fermented vegetables, uncooked sauerkraut, and some beers do have fermented foods. Or sorry, some beers do have live microbes. Fermented foods that are void of live microbes generally, and this is because of the process by which they're made. And usually, it's a process that involves heat, and that kills off any live microbiome. Live microbes. So chocolate, sausage, sourdough bread, tempeh, wine, beer, soy sauce, vinegar, and coffee beans. And then other non-fermented foods would be fresh sausage, vegetables that are pickled in brine or vinegar, chemically produced soy sauce, non-fermented cured meats and fish, and acidified cottage cheese. So those are examples of non-fermented foods that some of us may have thought that those were actually fermented. Some of the possible benefits of fermented foods. It facilitates digestion. It makes digestion quite a bit easier. Some people that maybe couldn't tolerate dairy products sometimes will be able to tolerate small amounts of dairy products once they're fermented in like a yogurt or something like that. And there's a chemical mechanism behind that. Can also improve the palatability, the taste, the texture, that kind of thing. Sometimes it can increase concentrations of vitamins and different bioactive compounds in the foods. And there's quite a few different benefits that you can see there. Also, they may be a source of live active microbes, and they may inhibit pathogens and food spoilage microbes. So whenever you are, the caveat here is that it's great to eat fiber, and it's great to change your diet to incorporate more fiber. There has been shown some benefit in fermented foods as well. However, whenever you're making any kind of change, and as pharmacists, we always say this to our patients, just start low and go slow. If you're someone who never consumes any fiber and all of a sudden you start consuming, 20, 30 grams of fiber, that's going to be quite a shock to your gut. It can also affect the absorption of some medications and supplements and that kind of thing. So do this hopefully with a healthcare professional or some kind of like pharmacist or primary care provider. But just be aware that if you start low and go slow, you're more likely to have a positive outcome. So I just wanted to kind of remind you all of that today. And then these are my references for our presentation. I hope that you've learned something. I tried to get through that as quick as I could without being too hasty. What did you think, Graham? Any comments or corrections?
That was awesome. No, that was a lot of information in that. It kind of reminded me of the last 25% of the book. A really good overview. And I noticed some questions while you were there, Lindsay. Does a strict carnivore diet potentially influence chances of dysbiosis proliferation? And typically not. And we wouldn't really recommend processed meat, but anything you eat can change your microbiome. But there's no evidence that just having a carnivore diet is going to cause dysbiosis or anything like that. And the question about the benefits of whole milk kefir to the gut biome, and that's been shown to be a benefit too. But yeah, great talk.
Yeah, those are great questions. Keep the questions coming. and your comments. Was your biggest takeaway from all of that? I know it's really a fire hose of information, but again, you can watch on the replay later, right? Patty Rivers says, hello from Richland, Washington State in the US. Thank you for providing this information. It's so important for our health. Thank you so much for the comment and for letting us know. That's what we're trying to do here, right? We're trying to give you the right information so you can make these decisions. Graham, are you ready to give them even more insights?
I think I am. I think my head is full from everything you just said, but
Yeah, I apologize for that.
no, that was awesome. There's a lot of information there. So yeah, if people can go back and have a look at it, and um,
Oh, and I should say, Graham is the author of the book Gut Logic that we're featuring in our book club. He is also a pharmacist, and he owned his own pharmacy for 20 years in Baddeck, Nova Scotia. He just sold his pharmacy, but he still works as a pharmacist, and he appears in the media across Canada. He appears on the radio. He also, his first book was called, or is called, and I have it here, Healthy Logic, which I also love. And I got another copy of it because it's just excellent as a reference to have just in your house. It covers just a ton of different topics. So we gave Graham like a longer intro in the first session, but Graham, I just want to at least let people know who you are. And yeah, take it away. I'm looking forward to hearing from you.
Yep. You'll also notice on the book too, there's this woman's name, Lindsay Dixon, and Dragana Skokovic as well. So Lindsay had a really good section on what she just presented there. And if you're looking for what to eat and how to affect your microbiome without even taking probiotics, that's a really good section to look at. So what I'm going to be going over would be the what gut health is, cholesterol, and weight management. So cholesterol and weight management aren't things that are normally looked at by people that look after your health, at least through probiotics. But there's a lot that we don't know about probiotics, and there is a lot of evidence that's come out in the last 10 years on how probiotics affect cholesterol and weight. So full disclosure, if someone's coming to me looking for, and it happens with pharmacists all the time, how do I lose weight? I'm not going to say take this probiotic and just go about what you're doing anyway. It's a lot different than that. Weight loss with probiotics in most studies would be probably around 2% of your body weight. But if you're looking to do anything you can to help lose weight, then it's there. And it really speaks to how much we really are learning about probiotics right now and the different uses they have. So as a pharmacist, when somebody asks me a question, I'm always putting it in a frame of reference of medications. So what harms the gut health? And Lindsay went through things like stress and, lack of sleep, diet, that kind of thing. But there are a lot of medications we take that can affect it as well. And NSAIDs, non-steroidal anti-inflammatory agents that you're using for pain, either prescription or non-prescription, notoriously are bad for the gut. So not even a direct irritant effect, but after you absorb them, the decrease in prostaglandins, which protects the gut lining, that goes down. So we have to be mindful, even when you're taking NSAIDs with food, that you can still long-term taking them have a problem with gut damage. Antibiotics, of course, we're talking about live microorganisms. So if you're taking an antibiotic, that's going to affect the gut microbiome. And typically, the earlier on in life you start taking antibiotics, the more drastic effect it can have. Now, amoxicillin, which is something that's quite often given to kids under 2, doesn't seem to have the most drastic effect on your microbiome. But other antibiotics like clindamycin, for example, which is one of the main antibiotic causes of C. diff infection, ciprofloxacin, minocycline, these ones are a little bit stronger with their effect on the microbiome. Potassium is notoriously bad for damaging the gut, and not really so much for the effect on the microbiome, but just physically damaging the gut. With potassium, if you have any issues that are slowing down your motility, if your fiber is down in your diet, then this could be a bad situation, you can actually cause direct damage to your gut with potassium. Going down that list, we'll talk about metformin and the effect that it has on the gut. Olanzapine, risperidone, quetiapine, clozapine, all the antipsychotics seem to have some effect. Of course, chemo, with pretty well the first dose, is going to have a bad effect on the gut, which is why you get a lot of diarrhea sometimes on chemo agents. Alcohol has, there's always a debate. Is a drink of alcohol good every day? There really is no amount of alcohol that is good on the gut, unfortunately. Laxatives, which are helpful to keep things moving, which you think would be improving the microbiome health, laxatives can have a detrimental effect sometimes on the gut microbiome that is separate from the constipation that you're having. There's a really interesting connection with statins that has with the microbiome. And there was a study actually out there that there was 100 subjects and they were on simvastatin. And some of the people on simvastatin had a really, really good lowering of their cholesterol, and some of them hardly had any. And what they found out is that there's three main bacteria that will produce three different bile acids, and these bile acids will actually help with the simvastatin and its cholesterol lowering. There's five other bile acids that compete with simvastatin in the liver, and it actually keeps the statin from working properly because it's bound to the cell in the liver that the statin is trying to bind to. So the three specific ones that they found, they're thinking, there might be a way, and we'll talk about this in a little bit from the journal Nature, that in the future there may be a way that we could help lower cholesterol with probiotic, at least added on to current therapy. ASA, because ASA is also similar to the NSAIDs, it's going to be causing problem with the gut. PPIs are proton pump inhibitors, so there's an estimate that between 10 and 12% of the whole population are on these acid lowering medications. And because the stomach is really your first defense in your stomach and throughout the GI tract to get bad bacteria from coming in, once you get rid of that acid, it seems to really change the microbiome. We'll talk briefly about that as well. And I think I just advanced just a couple there. So let's start with the proton pump inhibitors. Like I said, about 12% of the population of the world is on this right now. Saved a lot of lives. If you have uncontrolled acid going into your esophagus, it can cause a lot of issues, and just discomfort is the main reason people end up going and getting put on omeprazole or pantoprazole, the two most common ones that we see. What it does is it leads to a decreased diversity of the microbiome because now there's no gatekeeper keeping any bacteria from coming into the gut, and all of a sudden there's all kinds of new bacteria taking up residence, and it can be in a dose-dependent manner. So the higher the dose, certainly the more acid that's getting stopped getting produced, so the more bugs that can come through. So metformin, interesting thing about metformin is that diabetic patients, and this happens with almost any medical condition, the gut microbiome seems to be different for every single um, medical condition there is. And they looked at diabetics and they saw that diabetics had a different makeup in their microbiome as well. It's found out that a lot of this was due to the metformin they were taking, and up to a third of patients that are on metformin have GI effects, and it's now found to be the main culprit for that microbiota change. So it shows the need to really look at confounders or different disease states when it comes to effects of medication. And again, like Lindsay said, science is changing on probiotics every single day. So what was not even heard of before, the how metformin could even cause a change in your microbiota, is now well known. Polyethylene glycol is a really common over-the-counter medication for constipation. So all ages use it. It can be used every single day. It's not absorbed. It's usually considered to be fairly safe to use. And when you're using polyethylene glycol, even when it's not causing loose stools, you can still have a negative effect, unfortunately, from using the polyethylene glycol. And it depends on how long you're using it, but the longer you use it, then the more adverse effect that seems to have. So this is a shot from the story I was just talking about regarding a new way of treating this. This is very, very far off in the future, but it speaks to how we can actually deal with the cholesterol level with the right bug. And there are actually probiotics out there that can keep cholesterol from getting absorbed in the gut. So this is just published a week ago in Cell, and the Oscillobacter species is the one that they're looking at. And it's just new information, but the proposed theory is that the microbiome makes an enzyme that breaks down cholesterol in the gut. And the way the cholesterol kind of travels through the gut, you can see in this picture here, comes down through the liver and mixes with bile salts, and it can get reabsorbed or it can leave the body. Now, when you give a probiotic, some probiotics produce hydrolase, or they provide hydrolase to the gut, and that destabilizes the bile salt cholesterol that's moving through the gut. So it automatically leaves the gut then. So what happens is your reservoir of cholesterol begins to drop off in this cycle, and your blood cholesterol will actually go down. So this has become kind of a novel way to look at lowering cholesterol levels, because it was kind of odd. How could probiotics really do anything with your cholesterol level? Well, it turns out that through hydrolase, it's very easy for that to happen. So I'm going to go through some studies here, just to show, positive and negative studies, I guess, just to show where we're at with starting with cholesterol levels before we go on to weight loss. So metabolic syndrome there's usually 5 things that go on with metabolic syndrome. And this is the thing that we're all trying to prevent in this day and age. There's abdominal obesity, increased blood pressure, impaired fasting glucose, and you have an increase in triglyceride, but a decrease in the good cholesterol, HDL. So that's metabolic syndrome. Increases your risk of diabetes, heart disease, and stroke. And the best way to fend this off, and I talked about this in Healthy Logic, you want to maintain a healthy weight, you want to eat right, exercise, and don't smoke. So yeah, we're still telling people not to smoke. It's funny that we even have to say that now, but when you do those 4 things, then you can help with all of those biomarkers with metabolic syndrome. So these are from that study. They went through a lot of different other studies that were done. And the top one there, you can see that there was substantial proof that probiotic therapy application significantly reduced the risk indicators for metabolic syndrome. So total cholesterol was down, the LDL was down, and the waist circumference was down. Increased the HDL, which is your good cholesterol, which is the cholesterol leaving the body. Another study by Cicero on typically elderly patients over a 2-month trial, and you need at least 2 months to really get a result for this. 8 to 12 weeks is usually what you want to try to give your probiotic for to give it a chance. So this L. plantarum, L. acidophilus, and the reuteri, these are 3 common ones that come up with the AE Probio site that Lindsay mentioned, and I'll show you that page from that site coming up with the recommendation. There's a decrease in the LDL. Unfortunately, this one had a decrease in HDL and total cholesterol. You typically don't want to lower your HDL too much. And there was a decrease in metabolic syndrome prevalence. So it's one thing to say that we can lower cholesterol, but the endpoint that we're really trying to affect is the metabolic syndrome. That's what we're really trying to keep from happening. There's another study there. Probiotic group showed a remarkable reduction in the BMI, total cholesterol, and LDL again. And the bottom one shows, it's interesting, this bottom one here, there's a study, they had a yogurt, and the yogurt had the bifidobacterium and the acidophilus in it, but it also had microencapsulated bile salt hydrolase, active lactobacillus reuteri. So it had this hydrolase in it. And as I just told you, when you have that hydrolase in there, it can really lower cholesterol quite substantially. And that's what they found with this yogurt. And there's the Lactobacillus plantarum again. This comes up quite often when we see cholesterol lowering. So this meta-analysis, and a meta-analysis is just a study of a group of studies. Randomized controlled trial, randomized means you've got a group of subjects. You just divide the whole group in two. One gets the placebo and one gets the active drug, placebo being the control group. So a randomized controlled trial is the standard, and in the AE Probio site, that's what's called level 1 evidence. So what they found in this meta-analysis over all of the studies they looked at is that the consumption of certain probiotic strains, and this is the key, it has to be very specific, the probiotic strains that we're giving, can improve lipid metabolism, particularly reducing total cholesterol and LDL. So these are the two markers you really want to lower. You don't want to touch too much the HDL. If you raise it, that's pretty good, but you don't want to lower HDL because that signifies what's leaving the body. And if you're lowering that, it means there's less leaving the body. The thing I like about this study, it does mention several limitations, and it does spell out that clinical evidence is not sufficient to recommend probiotics as a non-pharmacological activity alternative for improving lipid metabolism. So again, I don't think we're really going to be recommending probiotics as your first line treating of high cholesterol, and it's never really going to be on its own, but as an adjunct to treatment that's already happening. That's where the use of probiotics is going to be with cholesterol. And again, long-term intermediate cardiovascular outcomes. So not just looking at cholesterol, we're looking at cardiovascular outcomes in this study. This is overweight and obese patients and a systematic review and meta-analysis. So we're looking at a bunch of studies. This one had 25 randomized control trials. And the conclusion, again, was that obese or overweight patients, the BMI, the body mass index, weight, and the LDL were lower in patients who got the probiotic compared to those who received controls. The markers that were not affected were other lipids, glucose, and blood pressure. So glucose was not affected really at all by any of the probiotics. One thing about doing your own study instead of doing a meta-analysis, meta-analysis is really good, but when you do a specific study, you can pinpoint the exact probiotic that you want to use for the exact medical condition. When you're doing these meta-analysis, you're basically grouping a bunch of studies, and whatever probiotic they happen to use, that's what you're kind of stuck with. But it does give a good cross-section of what the probiotics can do. So this is from Dragona's AE Probio site. And the writing is kind of small in here, but you can see the circle under the LDL-C. So this is the LDL cholesterol, and the Purica probiotic cardio. And whenever I give a talk on probiotics, I spell it right away. There's not a whole lot of sense of doing these talks unless I give you the brand name. So giving medical talks, you're probably trying to avoid, in most cases, brand name. You're going to use generic names. But if I gave you the names of all of those probiotics, you're really not going to get too far. Here's the brand name and the level 2 evidence, which means it's a randomized trial, but there was no placebo group that was used for it. The Canadian flag there means it actually has Health Canada approval for this indication. So it's a capsule a day, and it's 1 billion CFUs per capsule. So probiotics and weight loss. Again, we have people come to us all the time looking for best ways to lose weight, and this would be an add-on. And like I say in the book, there's a lot of studies that have looked at this. We're not seeing people losing 80 or 90 pounds just on probiotic alone. Losing weight is much more complicated than that, and we can't just kind of rely on just one thing, regardless of what it is, to lose weight. Certainly not probiotics. So this is a systematic review. And actually, this is in the book, a review done in 2021. I'm just reading here from the book that these 27 articles on probiotics and weight loss in human subjects, although it made recommendations in its conclusion that more studies are needed to find the exact recommendations on strains and dosages. The more studies should zero in on more specific populations with respect to age, sex, and overall results on probiotics were quite positive. They were really saying that things seem to be working, but we need really more specific, detailed studies on individual probiotics. So they took 204 articles and they weeded them all down to 27. Some of them are duplicated, some of them weren't randomized, but they got 27 in the end. Studies were worldwide. A lot of them were from Europe, and then there were some from the Middle East, and then there was a few from North America. So it was good to have a multi-center cross-section. Mostly male and female. There were a few studies there that were only female. The average age is 31. Every single one of these was randomized, controlled, double or triple blinded. So what that means is that the people that were taking the data on, from the subjects, they didn't know if they were getting the active or the placebo. So blinded studies are much better than unblinded. 11 studies combined with weight loss strategies with the probiotic Synbiotic, and only 2 showed no difference in weight. And then the remaining studies that had no weight loss strategy at all, they just used probiotics and Synbiotics. They showed a positive result in all but 1. So, again, these people weren't losing 100 pounds on a probiotic, but there was positive results in pretty well 90% of the studies. And there's dragging this site again. So for weight management, WM, the ultraflora control has level 1 evidence, meaning randomized placebo-controlled trial of at least 1, and it has Health Canada approval. There's also Health Canada approval for HMF metabolic, which is a multi-strain preparation with level 2 evidence. So randomized, just not controlled. And both are Health Canada approved. So, if you're a prescriber or anybody that's, because you don't need a prescription for this, if you're a dietitian, if you're helping somebody to lose weight, at least you have this to go by. Ultraflora control has level 1 evidence, and we have Health Canada approval saying that it is useful for weight management. Because I gave a talk to Dalhousie about a month or 2 ago, and the feedback, and it was just all on probiotic. And the feedback was most people of the 80 people that were on the online event, they really had no idea the wide-ranging uses that probiotics had. Now, I didn't go too much into weight management cholesterol, but they certainly were going to be changing the recommendations based on what I told them on antibiotic associated diarrhea, that type of thing. This was kind of an interesting study. Probiotic with fiber or without fiber controls body fat mass, and this is also a randomized controlled trial. And they were put into 4 groups. The first group had placebo. The other had microcrystalline cellulose, which Lindsay has spoken about in her talk. There were 2 different probiotics they used. One was the LU, and it turned out, I believe the LU in the end didn't have any real effect, but the other one did. It turns out that the combination of the 2, the LU and the B420, when they were given together, they did lower body weight. And when they were given with the microcrystalline cellulose, they also lowered it over placebo. So, in the discussion, the clinical trial demonstrated that probiotic without dietary fiber or with dietary fiber controls body fat mass. So the B420 and the LU plus B420 also reduce waist circumference and food intake, which is kind of amazing when you think of a probiotic reducing food intake. The LU alone had no effect, so they were able to narrow down the best combination to give. And that one is also in the AE Probio site. So, as far as confusion, the general public would be inundated with information, positive and negative, about probiotics. This was a pre-diabetic management with probiotics, another systematic review of clinical trials only. And in the conclusion of this one, the systematic review found that probiotic, prebiotic, and synbiotic, and we know what those all are from Lindsay, those supplements have beneficial and helpful effects on metabolic parameters. So, metabolic syndrome, they also help to change the microbiotic composition. And seems to be a common question, that can you actually affect your microbiotic composition by taking probiotics? And what's actually in there in your microbiota is less important, because everybody has a different composition than the supplement that you're taking. Um, what's been tested specifically in a probiotic for a specific condition is really what you're looking for. It's not really doing a study as far as a sample of what's in your gut. So this also had a positive effect on obesity index in pre-diabetic individuals. Now, the reason why there's some confusion here is that this study, Review of Probiotic Supplementation in Healthy Adults, European Journal of Clinical Nutrition, Helpful or Hype. So they admit that evidence supports the role of probiotics in improving the immune system response, stool consistency, bowel movement, vaginal lactobacilli concentration, but there's insufficient evidence to support the role of probiotics to improve lipid profile. So, after all these studies I gave you, and then this one comes up, it's no wonder that not only the public, but physicians as well can be kind of confused as to what to recommend. And all it takes is a study like this to kind of throw things off. The one thing I'll point out about this study, though, is that you can see in that bottom rectangle that they were only looking at studies where healthy adults were taking probiotic. And it's important to note that there really is no reason to take a probiotic to affect anything in your body if you have no reason to take it. The only reason you would take a probiotic is if you have an issue like colitis or irritable bowel, or you're trying to prevent traveler's diarrhea or antibiotic associated diarrhea, or anything else in the AE Probio list. So, we certainly can't throw this study out, but giving it to healthy adults is something that we typically wouldn't recommend. So going forward on this, it's difficult to cover everything certainly in 1 week, and going forward, I've looked at the list of speakers and the list of topics that we'll have going forward, and it will start to unfold kind of like a puzzle. And I think you'll certainly learn a lot about what probiotics can do and what they can't do. Because the one thing when I healthy logic is I wanted to make sure that um, we didn't kind of oversell anything. The probiotics are great, but they're not great for everything. So I think
Absolutely.
that's the one thing you want to take off.
Absolutely. Thank you so much for that, Graham. That's a lot of information to digest, but you presented it in a really clear way. We did have some questions that came in during your presentation, and so we're just moving into the Q&A portion of today's session. So if you do have any questions on either the topics that I presented on, so fiber, fermented foods, prebiotics, probiotics, postbiotics, symbiotics, or what Graham was talking about as far as cholesterol, weight loss, and gut health, please do leave your questions or even your comments um, in the comment section, and we'll start pulling those up. I'm not sure if we had addressed this one earlier. Does a strict carnivore diet potentially influence chances of dysbiosis proliferation? I think you did speak to this one, didn't you, Graham?
Yeah, yeah. So the answer was as long as it's not processed meat, then it's not going to cause that. At least there's no evidence that it will.
hmm And another question that came in, I think you do address this in your book as well, is how do oral contraceptives affect gut health?
Typically in a negative manner, but the circulation of hormones through the body, it's almost like the way cholesterol is because they're both hormone related. So the effect that the the probiotic, or sorry, the oral contraceptive has on the probiotic is slightly detrimental. But the oral contraceptive does need the bacteria there in order really to work, and this is
Yeah.
why sometimes there's that interaction with antibiotics and oral contraceptives, which I think really turns out to be a lot less than what maybe you and I were taught in school, Lindsay. But
Yeah.
we certainly like to mention it to people when they get their antibiotic.
Yeah, that does seem to be what the latest evidence is. It seems to be less significant than we initially thought, but yeah,
Yep.
still something to keep in mind. A really interesting question that came up from Chris Silura. He said, "I've been hearing a lot about a probiotic called Seed, SEED. I've never heard of this one. It has a capsule within a capsule to get through the digestive fluids with better actuation within the intestinal tract. Any thoughts on this?" I haven't heard of a product like this, but I've heard of the concept of this, and I know some products like this are being developed. How about you, Graham?
Yeah, I have heard of it. It's just another brand of probiotic. I've never carried it in the pharmacy, and I think typically, um, if I'm not mistaken, I think they're mainly gearing it towards digestion, or improved digestion. But I honestly, it's a blend. It's not just one probiotic that's in there, and they at this point, there's a kids version and an adult version, and I doesn't show up, I don't think, on any of the AE Probio recommendations. So honestly, that's the site that we go to. If there's something on there that shows that something works, then we recommend it. And that's not to say that Seed has any issues with it at all, but based on what we know, that is the site that, as a pharmacist, I go by to make a recommendation.
Yeah, and we are using the AE ProBio website or mentioning it quite a bit because it is a free resource that is available for the public and for healthcare professionals, but it's evidence based. It's reviewed annually, and it just helps give a guide because, as Graham was saying, if you're a healthy individual, there's generally really not any need for us to be recommending that you take probiotics. But there is evidence if you have a specific condition for some strains of probiotics, there is some evidence that they can be beneficial, but it depends on the strain and it just depends on the quantity. And so AE Probio has done a great job of putting all of that information into a reference that we can go to that does list the trade names or the industry names, because we cannot go by these these complicated strain names, right? They've got numbers in them, and there's no one can even
Yeah.
Dragana herself, the author, says that no one can remember these, right?
And seed has, I think there's 24 different strains in seed, and I'm pretty sure AE Probio has no recommendation on that many. And the capsule within the capsule to protect it is kind of brings up a good point, is that there are a lot of acid stable preparations that are out there right now. So that's just their way of doing it, to have it pass through the stomach. As long as you're doing it repeatedly, you'll get something through, and you just kind of continue taking it. And with probiotics, the new ones now, at least, they seem to survive the trip through the stomach a little bit better.
Mhm. Absolutely. So I don't know if we have any more questions coming in. If you're watching with us, let us know where you're from. And if you do have any questions, we've got just a couple minutes left here. If any questions for Graham or myself on the topics that we've covered today, in just a minute or so, I'm going to announce our special guest that we have coming for you next week. And where Graham and I are very excited about this, both the
Yeah.
topic and the guest. Actually, we just had one more question here, Graham, or kind of a comment and a question combined here. Cholesterol isn't inherently bad if not mixing with carbs and sugars when eating, they say. This is Chris Celera. For an example being the carnivore diet. Do you have any thoughts on this?
So, cholesterol in the diet, let's say eggs, whatever, is typically not so much the issue. It's how your body is handling it. And I would say maximum 20% of what you're eating is going to cause a problem. So it doesn't matter what your diet is or what you're eating with it, but you're right. Too much sugar is not going to be good either. But, the problem with cholesterol is if there's inflammation in the body, and there is a small bit of damage on the inside of the blood vessels somewhere in your body, that's where the plaque is going to start. So you've got your LDL cholesterol, your apoprotein B, and these markers are going to tell you how susceptible you are to having the plaque. So that picture that I showed there actually showed a plaque that had started to develop. So plaque develops, cholesterol begins to grow. Statins will actually shrink that, but if you're not on a statin and it continues to grow, it becomes as hard as your tabletop. It'll you know, keep growing, and it eventually it'll rupture and cause a clot. The clot will start exactly where the rupture was. So, um, of course, there are other things that are going to cause your health to go down, but as far as cholesterol, it's the inflammation in your body that's going to cause it to get worse.
That's a great answer and a great explanation and a reminder of
Yeah.
what can happen, right? Well, I don't see any more questions coming in. At the end of every session of our book club, we will be doing a Q&A, and so you can join in, and in the weeks to come, we will be having these Q&As. In case you think of a question that you didn't ask today, you can ask it maybe next week. Or in the weeks to come. We'll be airing these live sessions throughout April and May, usually on Saturdays at 4 p.m. PST. You're welcome to join us. These will be up for a limited time only, but you are more than welcome to join us. And if you do want transcripts from the Q&As, if you're not maybe unable to attend one of the sessions or something, you can go to www.friendlypharmacy5.com and sign up for a newsletter, which will give you exclusive access to these transcripts. And we do have special guests coming in. You really don't want to miss this. We have some incredible experts coming in. It's not just the author himself of Gut Logic, but we have others coming in as well to talk about gut health from an evidence-based perspective. So some of the sessions I wanted to share with you that are coming up. So we're going to be addressing IBS, so irritable bowel syndrome, and gut health. Also, leaky gut. What is this term that keeps coming up everywhere? What does it actually mean? How do we separate fact from fiction when it comes to this terminology? Gut health and respiratory infections. We have an incredible guest coming to speak on that. Probiotics and gut health specifically, women's health and probiotics. gut health, the gut-brain connection. So a lot of you are wondering about how our microbiome in our gut affects our brain, and there is a lot of evidence and new things that we know about that. And so we'll be covering that in one exclusive session, and also just some general ways that you can improve gut health and microbiome function. There are some other things that we have in store for you as well, but those are some of the sessions that I know that some of you have made comments and shown interest in, and so I wanted to share those with you as well. We just have like a couple more questions that just came in, Graham. I would just like to
Mhm.
go over quickly. There was a question about vitamin K2 and plaque reduction. I don't know anything specifically about that. What about, does that anything come to mind, Graham?
Yeah, that K2, that Rotterdam study, there was the people that had the highest amount of K2 seemed to have um, lower cholesterol values. So K2 is now something that we find in bone building um, preparations, because the K2 is what drives calcium to go to your bone. And we're trying to avoid it from every other tissue in the body. So all the soft tissue that might develop, any plaque which has calcium in it, not just cholesterol, we're trying to keep it away from that. So, K2 potentially does have a role in preventing the plaque from growing, but I don't really think I have enough at the moment to make a recommendation to take K2 to prevent plaque from developing. But
Hmm.
it has a role in it. Yep.
Yeah, definitely. And I know there's a lot of interest in K2 as well. And we have covered it on the channel here. I actually have two videos on vitamin K if you
Yeah.
want to know more about that as well. Another question about inflammation and its role, interplay with cholesterol. So, is cholesterol like the repairman? If you lower inflammation, do you also lower cholesterol? Um, Not sure where this is coming from exactly, but
Yeah, so the cholesterol is really kind of separate. So cholesterol has its own
mhm,
little chain that it goes through, goes into the gut, back in, keeps circulating around. It's what happens to the cholesterol. So there are countries in the world where cholesterol is really high in their individuals that live there, but they don't seem to have a lot of heart disease. So it's not just about the cholesterol; it's what happens to the cholesterol and where it deposits. So the inflammation certainly is what helps to drive cardiovascular disease. And there's taking something like a statin to reduce high cholesterol without knowing where your plaque is, or even if you have any plaque, is certainly a good move. And I think statins have gotten a bit of a bad rap over the last number of years, but it's really the only thing that we have as far as medication goes that's proven to have any effect on reducing heart attack risk.
yes, thank you for that. And I have to mention Jim from LinkedIn. Jim Dehaney is one of our friends, pharmacist friends from LinkedIn. Great question from Jim here. Thanks for joining us. So another great job is a recommended remediation for metformin disruption of in the probiotic guide. So I think he's referring to how metformin can adversely affect the gastrointestinal tract, and so could probiotics possibly help with that? That's actually something that I was thinking as you were presenting as well. And I'm not sure if there is a recommendation in the AE Probio guide for that. Do you know, Graham?
I haven't seen it, no. In fact, it was just really in even as a pharmacist, I wasn't really completely aware of the effect that it could have on the microbiome. Certainly, giving yourself a probiotic is not going to hurt, but I don't. We really don't have anything in that guide. I don't think that mentions. I don't think metformin use at all.
Hmm. Okay, fair
It's
enough.
a
If
good
it, if
question,
it
though.
It is a good question, and if the evidence isn't there, we will always tell you guys that. So, but thank you,
Yeah,
Jim, for joining us. It's really nice to see you there. So, finally, I just wanted to share this comment from Carol Webb. Carol Webb is from Kentucky, home of the Kentucky Derby, actually, and she says, "Thank you so much for these." So, thank you, Carol, and thanks for the hearts. That's really sweet. So I promised you that we would be giving away one book of Gut Logic to a lucky person who comments or lets us know where they're from. And so today, the book, let me just have a look here. Today, our book is going to go to, so one moment here.
The
Here we
suspense.
go. The suspense. Yes, the suspense. It's going to, I actually think I remember who it was. Sorry, let me just find it here because I've lost it from my notes, but I remember seeing your name. It's going to Chris Salura. Chris, you were quite interactive in the comments, had lots of questions for us. And so we will be sending out a hard copy of Gut Logic to you. So if you can email me at friendlypharmacy5@gmail.com, send me your address. We will send this out to you. Graham will send this out to you. Graham is from Ohio. Yep. Thank you so much for joining us. Now, I want to tell you who we have joining us next week. So thank you again, Graham, for that incredible presentation and for answering all of our questions. Next week, Graham will be with us. He'll actually be with us in all the sessions. Session 3, we'll be covering irritable bowel syndrome with Dr. John Damianos from Mayo Clinic. Dr. John Damianos is a fellow in the Department of Gastroenterology and Hepatology. He is an incredible educator and speaker on the topic of gut health. He's very passionate about this topic, and he is going to cover this session with us. And there will be a Q&A at the end of his presentation with him as well. And we will be giving away another book of another hard copy of Gut Health. So I think that concludes everything, Graham. Was there anything else you wanted to mention?
No, actually, that was a really good session. A lot of good information there, and thanks to everybody. I can see that was joining in there, so that's great.
Absolutely. Thank you so much, Graham. Thank you for everyone that joined. Please be sure to join us next week with Dr. John Damianos. Graham and I are really excited for that session. And I hope that you can maybe catch the replay. That was a lot of information. Go over it again and bring us your questions and comments for next week. I hope this was valuable. Thank you.